All right, welcome back. This video will speak about wisdom teeth and what to do about it when they become symptomatic. Let's remember that wisdom teeth are essentially the last teeth in the jaw, and a lot of times they do not have space to erupt. So they erupt in very weird positions. Sometimes they do not even erupt at all. They can harm the adjacent teeth because when they don't have space, they kind of push against the adjacent teeth and they push against the whole dentition. People come complaining of their teeth shifting, the front teeth shifting. Most times it is because there is no enough space for all of the teeth to erupt and function properly, so they become crowded. Also, some patients who will develop symptoms, these are pain, headaches, and so on and so forth. We'll go over these symptoms later on, but let me explain to you a couple of things that makes wisdom teeth very tricky and very problematic. The fact that wisdom teeth don't have space, these are the teeth that are the most involved with the nerve that runs in the jaw. We have a nerve that runs in the jaw. It's a sensitive nerve, meaning that it provides sensation to the cheek. And a lot of times we have these wisdom teeth that have their roots intermingled with the nerve or very close to the nerve. And sometimes they can develop an inflammation in the site, and that becomes really very painful. They can develop a cyst in the site that also can become painful, even though in most cases they are dormant. So when they start developing symptoms, that is when we have to really pay close attention to where they stand and what to do about it. But in general, wisdom teeth symptoms are really bad symptoms to have. They cause severe jaw pain, swollen lymph nodes, sore throat, and even bad breath and infection. Sometimes patients come in with a locked jaw. That is to say, the jaw cannot even open. They cannot even open their mouth anymore. It is because of the swelling that is taking place as well as the infection. So, what are the options available for us when we have those type of situations? The very first thing that we want to do is take a three-dimensional x-ray. A two-dimensional x-ray shows the tooth in relationship to the nerve in two dimensions. However, a three-dimensional x-ray allows us to see the exact position of the nerve vis-a-vis the roots of the wisdom tooth. And this will dictate what type of procedure we need to implement in order to alleviate the symptoms. As you see here, there are two main modalities of treatment of wisdom teeth. The first one is a full extraction of the tooth if the extraction has a low likelihood of leading to a nerve damage or to complications that may arise from wisdom teeth. It does not necessarily completely remove the complications, but minimizes the complication if it is safe to take the whole tooth out. At, at times, we may elect to do a procedure called coronectomy or crown removal of the tooth, which essentially involves removing most of the crown and part of the roots and leaving the other roots, the remaining part of the roots that are in connection with the nerve or in close proximity to the nerve, leaving them there. When we leave these roots there, in 99% of cases, they become completely asymptomatic. They are dormant in the bone. They may stay in there for a lifetime without symptoms. They may migrate upward and actually erupt on their own within few years. It doesn't happen immediately. It happens within few years. And if they come out on their own within few years, they become distanced from the nerve. Then that makes them much more likely to be extracted without damage to the nerve. This is the most feared complication, which leads to numbness of the chin, numbness of the cheeks. This numbness in most cases is reversible, meaning that within few weeks to few months it should go away. In very, very minor cases, very rare cases, it can become permanent. But that is something that as a patient, you need to be aware of this risk. It may happen in extremely rare cases, but it does happen. And if it happens, you are aware of that before you elect to receive this procedure. Now, let's go ahead and talk about what could make you relax throughout the procedure. We usually, for most cases, use either general anesthesia, deep sedation with IV access, mild to moderate sedation, or nitrous oxide sedation. These will depend on how many wisdom teeth we need to take out, the position of the wisdom teeth, the level of complexity of the extraction or coronectomy that we need to do. And let's remember that after your examination, we're going to discuss these options and decide which one is the most appropriate option for you, and that is also the most cost effective or the least expensive, so that you make the right decision for yourself. Only nitrous oxide sedation, which is the gas that we give to patients to relax, does not require an escort to come pick you up after the procedure. They also do not require that you come in a fasting a situation. You don't have to. You can come in completely fed, had your breakfast or lunch, and come still receive the nitrous oxide sedation in order to be able to receive the wisdom tooth extraction or coronectomy. Let's recap what nitrous oxide does. It essentially relieves anxiety and fear. It also makes you feel the needles and the injections much less than you would if you did not receive nitrous oxide or any type of sedation. It does relax your tongue, it relaxes your muscles in general, and allows all the muscles to essentially be in a relaxed state during the procedure, but also shortly after the procedure, which then allows you a much better patient experience. When we see you in the clinic, we're going to discuss your case and decide what type of option we're going to go with and what type of sedation option we're going to go with. But also, please make sure you watch my second video that's going to appear on the screen that speaks about what to do after your procedure. Thank you and take care.